The content is not a substitute of professional medical advice, diagnosis, or treatment. Always seek the advice of a physician for any questions you may have regarding a medical condition. Hello and namaste. It's me Bipana Gurung.
And it's me, Shrisa Kandel.
First of all, I would like to welcome you all to yet another episode of our podcast brought to you by Creative Callosum Nepal.
In this program, we'll be discussing about various diseases that we have encountered during our clinical postings. Without further delay, let's move on to today's case scenario.
A 4-year-old girl, permanent resident of Pulsok, Bharatpur, was brought to the emergency department of our hospital with chief complaint of sudden onset of cough and choking for the last 4 hours. According to her parents, the cough was sudden in onset, non-productive in nature, and associated with abnormal respiratory sound. Initially, the child was playful, but after some time she experienced difficulty in respiration. On examination, her respiratory rate was found to be 45 breaths per minute. It was shallow and associated with nasal flaring and grunting. There was no history of fever, hemoptysis, runny nose, and chest pain. On auscultation, wheeze was heard, and diminished breath sound in the right lung was heard. There was no cyanosis, chest retraction, and so what might be the possible diagnosis for this case?
Based on above symptoms and general examination findings, I think this might be the case of pediatric asthma. Pediatric asthma is the most common serious chronic disease in infants and children, which presents with symptoms like wheezing, coughing, and rapid breathing. This can also be the case of pediatric bronchitis, which is also common in children and has similar presentation. Owing to the sudden onset of dry cough and difficulty in breathing, foreign body aspiration is another important differential, as children's airway is more vulnerable to aspiration due to poorly developed protective reflexes like gag reflex and cough reflex and their tendency to put anything available to their mouth. Do you want to add any differentials?
Yes, other differentials can be childhood pneumonia, lung abscess, respiratory failure, and tuberculosis, but as mentioned in above case summary, there are no constitutional symptoms, so these are less likely to be our diagnosis.
We have discussed many differentials, so what investigations will you order to rule out these differentials and to reach your final diagnosis?
Here, to rule out possible diagnosis and to avoid misdiagnosis of life-threatening conditions like foreign body aspiration, pneumothorax, and acute exacerbation of asthma, investigations like chest X-ray PA and lateral and PA view X-ray of neck is in extended position, spirometry followed by blood investigation for total leukocyte count, complete blood count, CRP, ESR, and serum Ig level should be carried out. If the diagnosis is not confirmed by these methods, CT scan can be performed. You have received the reports of this case, right? Can you please read it out, Shrisa?
Sure, it goes like this. Spirometry showed normal FBC and FEV1 ratio, and blood investigation showed normal CBC, T, LC, CRP, ESR, and serum Ig level, thus excluding the possibility of asthma and any other infectious disease. PA and lateral view of neck in plain X-ray is normal, while plain chest X-ray showed radio plaques of plants lodged in right bronchus, which was 6 to 7 mm in diameter and circular in shape. Most probably a coiner bottle gap. Unilateral hyperinflation of the right lung is seen. Thus, this is most probably the case of foreign body in the right bronchus. Don't you think so, Bipna?
Yes, it is. Foreign body aspiration is not only very common in children, but also a life-threatening condition. If immediate emergency intervention is not performed, it can even become life-threatening.
So, what are the treatment modalities available for the foreign body aspiration?
All foreign bodies should be removed immediately by rigid bronchoscopy by an experienced surgeon. Sometimes it may not be possible to remove deeply impacted foreign bodies by bronchoscopy. An open thoracotomy procedure may be needed in pneumonitis, bronchiectasis, or lung abscess. Children suffering from such lung diseases and who are resistant to treatment should have a diagnostic bronchoscopy to rule out foreign bodies in the bronchus. So, what could be the complications of foreign body in larynx?
Foreign body aspiration may lead to obstructive emphysema, atelectasis, bronchiectasis, pneumonia, hemoptysis, lung abscess, pneumothorax, and bronchial stenosis.
In this episode, we discussed about the case of foreign body in larynx. Thank you for listening patiently. Don't forget to like, comment, share, and subscribe. We will be back with another episode. Until then, have a good time.